There's an uncomfortable truth that millions of men over 60 live with in complete silence, a reality that many prefer to ignore because addressing it means confronting one of their deepest fears. It's that sinking feeling that arrives without warning, when you realize that something fundamental about your masculinity isn't working the way it used to. Today we're going to talk about something that's rarely discussed openly, but could radically change your quality of life, and more importantly, could actually be protecting you from a disease that affects 1 in 8 men. I'm Dr. Megan Fischer, and here on Life After 65, I've helped thousands of men not only recover their vitality, but also regain their peace of mind. What you're about to discover today about your prostate and your intimate activity is going to surprise you, because science has proven something that challenges everything you thought you knew about your masculine health. Imagine for a moment that you could make a simple, natural, and pleasurable decision that would significantly reduce your risk of developing prostate cancer. Imagine that this same decision would improve your sleep, reduce your stress, and keep your reproductive system functioning optimally. It sounds too good to be true, but stay with me because what the latest medical research has discovered is going to completely change your perspective on a very intimate aspect of your life. Before we continue, I need you to do something for me. If this information seems valuable to you, if you feel like someone is finally talking about these topics with the honesty they deserve, give this video a like, subscribe to Life After 65, and comment below what city or country you're watching from. Your support allows me to keep creating real, scientific content for men who, like you, are looking for honest answers about their health. To understand why what you do in the privacy of your bedroom can have such a profound impact on your health, you first need to meet the protagonist of this story, your prostate. This small gland, roughly the size of a walnut, sits just below your bladder and surrounds part of your urethra. You can think of it as a small, highly specialized chemical factory. Its main job is to produce approximately 30% of seminal fluid, a substance rich in zinc, citric acid, and specific enzymes that nourish and protect sperm during their journey. But the prostate doesn't work alone in this complex operation. The seminal vesicles contribute most of the semen's volume, providing a fluid rich in fructose that gives energy to sperm. The testicles, though they contribute barely 2% of the total volume, provide the most crucial component, the sperm themselves. This entire system works in perfect synchrony, like an orchestra where every instrument must play at exactly the right moment. The ejaculation process is a fascinating physiological symphony that occurs in 2 perfectly coordinated phases. During the first phase, called emission, the sympathetic nervous system activates and all these fluids accumulate in the posterior urethra, waiting like actors backstage before their grand entrance. The second phase, expulsion, is when the pelvic floor muscles contract rhythmically, creating the pressure needed to propel semen outward. This perfect coordination depends on flawless communication between your nervous system and your muscles, which is why conditions like diabetes, certain medications, or stress can affect this process. Now comes the question that many men ask themselves but few dare to consult about. What happens if I don't ejaculate frequently? Can this affect my health? The answer isn't as simple as yes or no, but what science has discovered is absolutely fascinating. Think of a river that flows constantly versus a pond where water accumulates. Constant movement keeps water fresh and oxygenated, while stagnation can lead to problems. Something similar happens in your prostate. When there's no regular ejaculation, prostatic fluid accumulates in the small ducts of the gland. This accumulation can create what doctors call prostatic congestion, a condition that can manifest as pelvic pressure, discomfort when urinating, or even pain during erection. But there's something even more important you need to know. Let me tell you about a study that forever changed our understanding of prostatic health. At Harvard University, a group of researchers set out to answer a question that had intrigued the medical community for decades. Is there any relationship between ejaculation frequency and the risk of developing prostate cancer? What they discovered after following nearly 32,000 men for 18 years was revolutionary. Men who reported ejaculating 21 times or more per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated between 4 and 7 times per month. But here's the most surprising part. It didn't matter how that ejaculation was achieved. The protective effect was related to the physiological act itself, not whether you had a partner or not. This finding wasn't a statistical coincidence. Other independent studies conducted in Australia and Nordic countries have confirmed this inverse relationship between ejaculatory frequency and prostate cancer risk. A meta-analysis published in 2018 that reviewed multiple investigations reached the same conclusion. There's a real and measurable protective association. But why does this happen? What's the biological mechanism behind this protection? Scientists have proposed several fascinating theories that explain this phenomenon. The first and most intuitive is the prostatic flushing theory. Imagine your prostate as a sponge with thousands of small channels. Over time, potentially harmful substances from the environment, toxins from tobacco, chemicals from processed foods, even metabolites from your own body, can accumulate in these channels. Each ejaculation acts as a natural cleaning system, expelling these substances before they have enough time to interact with prostatic cells and potentially cause mutations that could lead to cancer. It's like regularly cleaning your house's pipes to prevent sediment buildup that could cause more serious problems later. The second theory relates to hormonal balance. Regular ejaculation could help maintain optimal levels of androgenic hormones within the prostate, including testosterone and dihydrotestosterone. When these levels remain balanced, prostatic cells don't receive excessive growth signals that could lead to abnormal cellular proliferation. A third explanation has to do with immune response. Sexual activity and orgasm stimulate the release of various substances that strengthen the immune system, including immunoglobulins and natural killer cells that specialize in detecting and eliminating abnormal cells before they become tumors. Finally, the intense muscular contractions during orgasm improve blood circulation throughout the pelvic region, which in turn reduces chronic inflammation, a known factor that contributes to cancer development in various organs. After hearing all this information, I know the obvious question on your mind is, do I need to ejaculate 21 times a month to protect my prostate? And here I want to be absolutely clear with you, because this is a crucial point that's often misinterpreted. That specific number is not a medical prescription you must follow to the letter. Sexual health is not a competition or a goal you should force yourself to achieve. Every man is different, and what's normal and healthy for you depends on multiple factors: your age, your general health status, your stress levels, whether you have a partner or not, your emotional state, even your current medications. Forcing yourself to reach a specific number can generate performance anxiety, stress, and psychological pressure that are counterproductive to your sexual and general health. What these studies teach us is not that you need to count ejaculations like exercise at the gym, but that a sexually active life appears to be a component of a healthy lifestyle that protects your prostate. The key is listening to your body, respecting your natural libido, and maintaining a healthy attitude toward your sexuality without pressure or guilt. If your natural frequency is lower than that figure, it doesn't mean you're in danger. If it's higher, it doesn't mean you're protected from all risk either. Health is much more complex than a single variable. Now, I want to talk to you about something equally important: the additional benefits that many men don't know about maintaining regular ejaculatory activity. Beyond possible protection against prostate cancer, there's solid evidence that orgasm has positive effects on multiple systems in your body. Orgasm triggers the release of a powerful cocktail of neurotransmitters and hormones, including oxytocin, prolactin, endorphins, and serotonin. This combination acts as a natural relaxant that can significantly improve your sleep quality. A recent study found that men who reported regular sexual activity had deeper and more restorative sleep patterns. Additionally, these same substances have natural anti-inflammatory and analgesic effects. Many men report that regular sexual activity helps reduce chronic pain, especially in the lower back and joints. Oxytocin, known as the bonding hormone, also reduces cortisol levels, the stress hormone, which can have protective effects on your cardiovascular system. For men who suffer from chronic prostatitis, that persistent and often painful inflammation of the prostate, regular ejaculation can be particularly beneficial. It acts as a kind of internal massage that helps reduce congestion and pressure in the gland, alleviating symptoms like pelvic pain, urinary urgency, and discomfort during erection. But now I need to address a very real concern that many men face. What happens if I have to undergo prostate surgery? This is a legitimate question because statistics show that a large proportion of men over 60 will face some type of prostatic problem that could require medical intervention. It's essential to distinguish between the two main types of prostatic surgery, because their effects on ejaculation are completely different. The first type is surgery for benign prostate enlargement, medically known as benign prostatic hyperplasia. This is the most common surgery in older men. With age, the prostate tends to grow and can compress the urethra, making urination difficult. Surgery seeks to remove the internal tissue causing the obstruction, but leaves the external prostate capsule intact. The most frequent consequence of this surgery is what we call retrograde ejaculation. During orgasm, instead of being expelled outward, semen goes backward into the bladder. This occurs because during surgery the closing mechanism that normally prevents this is altered. It's crucial that you understand you'll continue having normal orgasms. The sensation of pleasure will be exactly the same, and your erection ability won't be affected. You simply won't see semen come out, which is then eliminated completely harmlessly with urine. The second type of surgery is radically different: complete removal of the prostate for cancer, called radical prostatectomy. In this procedure, the entire prostate is removed along with the seminal vesicles to completely eliminate the cancer. By extracting these semen-producing organs, ejaculation disappears completely. However, many men can continue experiencing orgasms, though they'll be dry orgasms without fluid expulsion. This surgery is more complex and carries additional risks, particularly the possibility of urinary incontinence and erectile dysfunction, because the nerves responsible for erection pass very close to the prostate and can be damaged during the procedure. Fortunately, modern surgical techniques, especially robotic surgery, have significantly improved nerve preservation and functional outcomes. I want you to know that if you ever face this situation, there are multiple treatment and rehabilitation options that can help you recover much of your sexual function. Medicine has advanced enormously in this field, and many men manage to maintain a satisfying sexual life after these procedures. I'd like to hear your perspective on all this. What do you think about this information? Has any particular fact surprised you? Leave me a comment telling me what caught your attention most, because your experience and questions help me create content that truly responds to the needs of men like you. Now, after all this scientific information, I want to take you to a more practical and personal level. How can you apply all this knowledge in your daily life? The first and most important thing is developing a healthy mindset toward your sexuality. In our culture, especially for older men, there's a tendency to consider sexuality as something that belongs only to youth. This couldn't be further from the truth. Your sexuality is an integral part of your well-being throughout your life. It's not something to be ashamed of or something to relegate to the past. Maintaining a healthy relationship with your sexuality, whether with a partner or with yourself, is as important as maintaining your cardiovascular health or muscle strength. If you have a partner, open communication about these topics can enormously strengthen your relationship and improve the sexual experience for both of you. Many couples find that talking honestly about their sexual needs, desires, and concerns brings them closer and reduces performance anxiety that often affects older men. If you don't have a partner, it's important to know that masturbation is a completely normal and healthy practice at any age. It's not something that should cause you shame or guilt. In fact, as we've seen, it can have real benefits for your prostatic health. Many older men report that maintaining a regular self-stimulation practice helps them maintain their sexual function, reduces stress, and improves their overall mood. But remember, your prostate health doesn't depend solely on ejaculation frequency. There's a complete set of lifestyle factors that can significantly influence your risk of developing prostatic problems. Diet plays a crucial role. Studies have shown that a diet rich in vegetables, especially tomatoes for their lycopene content, can have protective effects on the prostate. Fish rich in omega-3 south, like salmon and sardines, have also shown benefits. Conversely, excessive consumption of red meat, especially processed meat, has been associated with higher prostate cancer risk. Excessive alcohol can also be problematic, though moderate consumption doesn't appear to have significant negative effects. Regular exercise is another important protective factor. You don't need to become an athlete, but maintaining regular physical activity, even walking 30 minutes a day, can significantly reduce your risk of prostatic problems. Exercise improves circulation, reduces inflammation, and helps maintain a healthy weight, all factors that benefit prostate health. Smoking is definitely a risk factor you should eliminate if you still smoke. Tobacco chemicals can accumulate in prostatic fluid and contribute to cancer development. If you need help quitting smoking, there are multiple resources and treatments available that can help you. Stress management is also crucial. Chronic stress can affect your sexual function, your immune system, and increase inflammation throughout your body, including the prostate. Techniques like meditation, yoga, deep breathing, or simply maintaining hobbies you enjoy can have real protective effects. But above all, I want to emphasize the absolute importance of regular medical checkups. There's no lifestyle factor, no ejaculation frequency, no diet or supplement that can replace early detection through regular medical examinations. The prostate-specific antigen, known as PSA, and digital rectal examination are imperfect but valuable tools for detecting prostatic problems in their early stages, when treatment is most effective. If you're over 50 or over 45, if you have a family history of prostate cancer, you should be getting these exams annually. I know many men feel anxiety or embarrassment about the rectal exam, but I assure you it's a quick, important procedure that can literally save your life. Don't let fear or discomfort prevent you from taking care of your health. An early prostate cancer diagnosis has cure rates exceeding 95%. Waiting until symptoms appear can significantly reduce your treatment options and prognosis. I also want to warn you about misinformation circulating on the internet about miraculous treatments for prostatic problems. There's an entire industry of supplements and products that promise to cure or prevent prostate problems without solid scientific evidence. Some of these products can even be dangerous or interfere with legitimate medical treatments. If you're considering any supplement or alternative treatment, always consult with your doctor first. He can help you evaluate available evidence and determine if it's safe and appropriate for your specific situation. I want to close with a personal and direct message. During my years of medical practice, I've seen thousands of men struggle with prostate problems, some detected early and treated successfully, others discovered too late, when options were limited. The difference almost always lay in the man's attitude toward his own health and his willingness to seek preventive medical care. You're not invincible, but you're not powerless over your health either. You have powerful tools at your disposal: knowledge, access to medical care, the ability to make lifestyle changes, and, as we've discussed today, even aspects of your intimate life that can contribute to your overall well-being. The information you've heard today shouldn't generate anxiety or pressure, but empowerment. You know more about your prostate than previous generations knew. You have access to better treatments and early detection techniques than men have had throughout human history. Your sexuality, your vitality, and your health don't end at 60, 70, or 80 years old. With the right knowledge and appropriate medical care, you can maintain an excellent quality of life for decades. Don't let age or social prejudices convince you otherwise. Here on Life After 65, my commitment is to provide you with honest medical information, based on real scientific evidence, without sensationalism or false promises. If this video has been useful to you, if it's given you valuable information you didn't know, or if you simply appreciate this direct and scientific approach, I ask you to share it with other men who could benefit from this information. Like this video, subscribe to the channel so you don't miss future content about men's health. And most importantly, share it with that friend, brother, father, or husband who might need to hear this. Your action can literally help save lives, because quality information, when shared, multiplies its impact. Remember, your health is your responsibility, but you don't have to face it alone. Modern medicine, combined with intelligent lifestyle decisions, offers you the best opportunities to maintain your vitality and well-being during all the years you have ahead. Take control, seek regular medical care, and never underestimate the value of staying informed. Thank you for your time, for your trust, and for allowing me to be part of your journey toward better health. Until the next video, take care and remember that investing in your health today is the best gift you can give yourself and those who love you.